Welcome to JK Plastic Surgeon channel. Today we will be talking about diabetic wound management. So what is diabetic wound, how it differs from other wounds, and how will you investigate and do testing, and how will you treat the diabetic wound. That's all I will see in this video. So how the normal wound and diabetic wound it differs. So normal wound can occur after your accident and road traffic accident and any ulcer. But diabetic wound, because of the increased level of blood sugar and low immunity of the patient. So the wound which heals by 2 to 3 weeks in normal individual, it takes months together for in case of diabetes. Why the diabetic wound is more problematic? Because of the long-term complications of diabetes. Diabetes, it affects nervous system, it affects vascular system. Nervous system, it means it affects the nerves, it affects the blood supply, it occurs in the late age group. See, for example, normal wound or road traffic accident, it can come on young age also. But diabetic wound, it comes only after 45-50 years. In aged people, the blood supply is also low, the nerves also, it is affected already. The healing potential, it differs from the age. In old age, it heals very late. So because of this, the diabetic wound, it takes much longer time for healing. One. Then how you investigate? You can do other local blood tests like blood sugar, HbA1c, and fasting and post-mortem blood sugar. The sugar should be, fasting sugar should be within 80 to 100. Post-mortem sugar will be 140 to 160, and HbA1c, it should be within 5 to 6. This parameters should be within normal limits to avoid the complications of diabetic wound. Okay, common people, diabetic wound, whom to sue? I will show that. Every doctor can see the diabetic wound. For example, MBBS doctors, they are seeing the diabetic wound. Recently, we have podiatric surgeons, MS general surgeons, orthopedic surgeons, all these people, everybody seeing and treating the wound. But who is the authority to treat the diabetic wound? This is the plastic surgeon. Because plastic surgeon knows how will you heal the wound when the wound is healing for a long time. So if you want to ask whom do you show the diabetic wound, the first person will be the plastic surgeon. Okay, then how will you treat the diabetic wound? So it depends upon the stages of the wound. Suppose the diabetic wound is very mild, only superficial abrasion like thing, then we can treat with mild antibiotic ointments and minimal dressings. Within a week or two, it will heal. For example, it goes, if you are not treating in any initial stage, it goes second stage, where the wound will become infected with because of bacteria, and it comes what is called cellulitis. Commonly, people will be asked, what is cellulitis? What is cellulitis? Means there is a wound which is getting infected by bacteria, which causes swelling and fever. All this local temperature will be increased. This is called cellulitis. In this case, what is the treatment? Cellulitis, then you have to admit the patient in the hospital. We have to give IV antibiotics, higher antibiotics. We will put IV antibiotics. Cellulitis will subside and we can do local dressing to the wound. Stage 2, it will heal with IV antibiotics and dressings. Stage 3, where you are not treating still, you are getting late. So stage 3, in addition to cellulitis, it causes deep tissue damage. That's called cellulitis and fasciitis, deep fasciitis, where the deeper tissue also, it will get infected. Then we need to go for a surgery. Third stage, we can do surgery. Surgery, what we will do? As plastic surgeon, we will give local anesthesia or general anesthesia. We will give anesthesia. We will remove all structures which are infected or non-viable, starting from the skin, muscles and tendon. Whatever it is not viable, we will remove all the structures. After that, if it is superficial wound, you can treat with same thing, antibiotics, analgesics, all these things. We can do dressings and we can heal the wound. Stage 4, it's a late stage where what happens? That's infection, it sets into the bone, which leads to what is called osteomyelitis. That means the bone is destroyed. As you all know, the support of the body, for example, there is a forearm. Forearm is supported by bones. Hand is supported by bone. Foot, which is without bone, how will you survive? People will be asking, why doctor you are telling amputation? This bone is lost. When the osteomyelitis goes deep into the bone is destroyed. So when there is no support for foot, you can't walk. Then doctor will advise amputation. The amputation also depends upon the level of infection. If it is concerned with only one toe, we can remove the one toe. If you are not treating properly, you are leaving well, then it spreads to the ankle joint. What is one more called? Sarco joints. That means the infection spreads deeper and all bones of the foot, it is getting destroyed. If you see some of the diabetic patients, they will be walking like the foot will be without any support, it will be hanging like that. In that case, it's called Sarco's joint, which is treated by below knee amputation. So, all treatment depends upon the stage of this disease. The patient initially treated with dressings, if you are not treating properly, land up in amputation. What ointments you can apply? This is a common question every patient will ask doctor. Doctor, what ointment will put? So, lots of ointments, lot of dressing materials are available. But in spite of that, it's not healing. Why? Because no ointment gives all treatment. Suppose if it is infected wound, we can give antibiotic ointment. The infection is cleared, then we need to give an antibiotic which promotes wound healing. There are a lot of ointments based on collagens. Collagen means it promotes the wound. The tissue will form and there is a cavity, tissue will form, it heals. Number 3, if the wounds are not healing with ointment and all, we will go for plastic surgical procedure. 2 types of procedure are there. Split thickness skin grafting. Skin grafting, there is a wound, deep wound, which has to be covered with the skin grafting taken from the thigh. Or one more surgery is the flap surgery. If it's still deep, we'll take some flesh tissue from nearby tissue and we'll fill up the case. That's called flap surgery. So starting from ointment to flap surgery, various options are there. The decision will be taken by plastic surgeon. Better you go earlier and consult a plastic surgeon. After seeing this video, if no patient should allowed to go for a amputation, that is my aim. Thank you very much.